All right, welcome back to Bayou Time. You see the eye behind me in the chart. Dr. Satish Arora, who is a retina specialist, is with us tonight on Bayou Time, and we appreciate him coming by. Let's go back to the phone lines. A lot of people wanting to know about the eyes tonight, so let's see what's on their mind. HTV, welcome to the program. Your question, please.
Hello?
Yeah, go ahead.
Is it me on?
It's you. Go ahead.
Okay, I have macular degeneration, and I see floaters as big as love bugs and marks a lot. I had 6 shots injection in one eye and 3 in the other, and I have the wet kind. What can I do about that?
Well, if you've been having the injections, assuming that they're one of the injections I'm thinking of, then you've probably had some of the best treatments there are. Now, the first thing to figure out is there still leakage? And your eye doctor can determine that by examining you and by doing testing with different kinds of tests, such as fluorescein angiography, which actually tests the blood flow in the back of the eye, or with OCT, optical coherence tomography. And that's a procedure that takes a scan of the back of your eye and helps us look for fluid. Now, if the fluid is gone, if the leakage is gone, the best thing to do is to give it time. In most cases, you don't truly know what the vision is going to be for a good 6 to 12 months after the treatment is done. In some cases, it can improve even beyond that. I've seen some people improve in terms of their sight a year and a half or even 2 years after treatment was completed.
Does that answer your question?
Well, I can see if I look direct at somebody's face, I cannot recognize it. I see the body, but not the face. And if I turn my head to the side, I can see them. So what causes this?
So she having more peripheral vision and...
Well, she does have better peripheral vision is what she's telling us, as opposed to her central vision. And what that tells us is that the leakage from the macula probably resulted in some scarring within the macula even after treatment. And there are procedures that various people have tried to remove those scars. However, most of those have not been incredibly effective thus far. There are several surgical procedures and medications that it looks like are coming down the pipeline that do show some promise for being able to reverse some of the damage caused by macular degeneration. And those might be able to help her, but we're still looking at a couple more years before that would be available.
So scar tissue is the big enemy here.
Correct, and that's the reason we do the injections, to do everything that we can to try to prevent the development of scar tissue.
Okay.
And I'm also a diabetic of 44 years.
Mm-hmm.
That's another problem.
And that doesn't help.
Well, sure, and the diabetes can affect the eyes in many, many ways. It can reduce the circulation in the back of the eye. It can cause bleeding or fluid and edema, swelling to build up in the back of the eye. It can cause elevations in pressure. There's any number of things that the diabetes can cause as well.
Well, man, we appreciate you calling and we wish you luck. Hope it works for you.
Okay, thank you so much.
Thank you. Bye-bye.
Bye-bye.
HTV, welcome to our program. Your question tonight for Dr. Arora. Hello.
Yeah, Dr. Arora?
Yeah, go ahead.
Hello?
Yes, sir.
Hello, Dr. Arora?
Yeah, go ahead, sir.
Yes, sir. I'm Joe Bear. I had cataract surgery done a couple of years ago. And I get a jelly on both my eyes real bad. And I like I'm blind. And when I bend my head down, my left eye hurt me really, really bad.
Okay.
So what can I do with that, sir?
Well, when you say that there's a jelly, is there actually something on your eye? Is there something that when you wipe your eye, you're seeing something there, or what's happening?
Yeah. Yes, sir. I had to use Q-tips. I used so many Q-tips. I passed on the bottom of my eye, and it stretches out real far on both of my eyes. And once I get the gel off my eyeball, I can stay good for another 5 minutes, and it comes back again.
Okay. But when you get rid of that jelly, it sounds like the vision improves. And so probably, well, there are a number of different things that can cause mucus to build up on the surface of the eyeball. And without knowing which of those things it is, it's difficult to tell you exactly how to treat it. But I think the best place to start for most people is to try an over-the-counter lubricating drop or an artificial tear. When things start to blow up like that, if you put one of those tears in a lot of cases, they'll clear it up.
Are you trying an artificial teardrop?
Yes.
Okay.
Yes, sir. I buy that moisturizer because my eyes are really dry.
Right.
Once I put that on my eyes, it makes the jelly come out more and more.
Mm-hmm.
And because my eyes are really dry, 'cause I had cataract surgery on both of my eyes,
Mm-hmm.
and my eyes are really super dry.
Could he be
And I
allergic
buy
to the
that,
drops?
that moisturizer for your eyes, that moisturized stuff for your eyes.
Mm-hmm.
And if it ain't doing no good, in the morning time my eyes are shut, I had to put a hot compress in my eyes for them to open in the morning time.
Okay. Could he be
Well,
allergic?
As Martin said, yes, it could be that you're allergic to the preservatives in the drops themselves. So there are also preservative-free drops that you can use. And if those drops don't get the job done, then at that point, I would consider seeing your eye doctor. And the reason I say that is, as I said earlier, there are other things that can produce those kinds of symptoms. And you want to make sure it's not more of a generalized allergy or some type of infection that could be doing that.
Okay, so you got to listen to the doctor now, all right?
Okay, doctor.
All right, thank you so much for
Okay,
calling.
Martin, thank you so much for your TV, and doctor, thank you so much.
Oh, you're
Thank
very
you for
welcome.
calling. We appreciate it. Glad we could help. HTV, welcome to the program. Your question tonight, please. Hello. Got a little delay tonight. You there? We don't want to miss anybody. Either that or they got real shy on us. Let's take another. Let's put that one on hold. HTV, welcome to Bayou Time. Go ahead, please. You there?
Martin.
Yeah, go ahead. Go ahead.
Hey,
Yeah,
okay, I got you.
yeah, you have a delay in your TV, so turn your
Yeah,
TV
I'd like
all
to
the way
ask the
down.
doctor about them floaters. But I got some little round ones, and I got some that look like spider web.
Mm-hmm.
Can I get anything done with this?
I guess what he's saying, they come in all shapes and sizes.
Sure they do. There's lots of different kinds. As we were talking about earlier, sometimes people will see them as little squiggly lines or as things that look like hairs or feathers, or in your case, dots and cobwebs, and that's not unusual. In terms of what to do about them, in most cases, the floaters, when they come on, they'll subside with time. In most cases, within a few months, you'll notice them a lot less than you did before. Now, in terms of getting rid of them, the only way to get rid of them entirely is to do surgery inside the eye. And in most cases, we don't want to do surgery inside the eye for floaters because there are always risks associated with any surgery anywhere in the body. And you hate to take a risk for a condition that we know is not going to do you lasting harm.
Now, let me ask you this also, do some people with blood pressure get eye problems, so they really have to take care of the blood pressure, don't they?
Surely they do. And what happens is blood pressure and diabetes and just the passage of time make us all prone to hardening of the arteries. And just like we get hardening of the arteries or atherosclerosis elsewhere in the body that can result in heart attacks and things like that, well, we get hardening of the arteries in the back of the eye too. And that can knock out the blood supply or cause blockages of the blood vessels or bleeding in the tissue and swelling in the tissue. And so it's very important to control the blood pressure.
Right, yeah. Good idea for that. HTV, welcome to the program. Your question, please.
Am I on?
You are on. Go ahead.
Okay, I'm sorry. I experienced what I guess is those floaters. I had exerted, I had cut the grass, and then it was like it seemed like in one eye, the left eye, and it was like little bats flying. And then, but it went away over time. Is that considered a floater?
Well, most likely it was a floater. My only concern there would be the way you described it. I would want to know what caused the floater.
Okay.
As we said, everyone has floaters, and it could just be that was one of the usual floaters. But it could also be when people develop floaters all of a sudden, sometimes that indicates a vitreous detachment, where the gel inside the eye actually pulls away from the back of the eye. And a vitreous detachment itself is not such a big deal. The danger is that sometimes that can cause the retina to actually tear.
Okay.
And that can lead to a retinal detachment. So if you suddenly get new floaters or new flashes of light in an eye, it's a good idea to see your ophthalmologist as soon as possible.
Yeah, I'm going Monday.
All right.
Okay.
Thank you so
very
much.
much.
Thank you.
Bye-bye.
Bye-bye. HTV, welcome to our program with Dr. Arora. Your question for the doctor.
Hello, Mark.
Yeah, go ahead.
I have two questions for the doctor.
All right.
Number one is I've heard about this radio wave to correct eyesight, and my eyesight is bad because of age. Is this a good avenue to take? And the second thing is I've worked in a fabrication yard just about all my life, and you have people that don't wear safety glasses. I have to keep reminding them, or maybe people even weed eating around the house, and they get a piece of metal or something in their eye, and the procedure that they have to go through because they have a tissue that grows over that within 24 hours. Maybe just inform the public a little bit.
Okay. Radio wave was his first question.
Well, radio waves in and of themselves are not proven to have a lot of benefit for the vision right now. In most cases, we use lasers for vision correction procedures, and they are quite effective. Again, it's important to see your eye doctor so that you can find out if your eye is amenable to having that kind of procedure, but lasers are going to be a lot more effective for that. Now, the other thing, as you mentioned, was that you had a lot of people working with you who don't use their safety glasses, and I'm glad you're staying on them, because I've seen some terrible injuries through the years from people not wearing their safety glasses. In most cases, people get lucky, and the metal or other foreign object stays on the surface of the eye, and we can remove it from there. And if you've known anyone who's had that happen, it's pretty painful. When you talk about it as being lucky, it's still a pretty painful thing. Now, the real danger is that in some of these cases, it can actually go into the eye, inside the eye, and cause real severe damage to the eye. If a foreign object actually gets inside the eye, it's entirely possible to lose the eye, and the foreign object has to be surgically removed as soon as possible. So I hope you keep on those people about wearing the safety glasses.
Does that answer your question?
Yes, thank you very much.
You're quite welcome. Which he brought a good point. I had a summer job in a shipyard, and I'll never forget the foreman saying, okay, when you walk by the welders, make sure you don't look at them when they strike you. Well,
Yes, sir.
what did I do the second day? I happened to be looking right at them when they struck it, and I got a welder's flash. What
Correct.
causes welder's flash?
Well, it's the radiation coming from the torch, and the radiation coming off of there is a frequency such that it will actually burn the surface of the eye or inflame the surface of the eye. And as anyone who's ever had a welder's flash, including you, Martin, can say, that's really painful.
Yeah. They told me everything. Put potatoes on your eye. Do anything cold, I guess, would help, huh?
And all of those things are for comfort. Artificial tears, as we talked about earlier, or certain lubricating ointments can help. But the only thing that's going to cure the problem is time.
Yeah, because it almost felt like I had sand. Is that because it blisters?
It's because the surface tissue of the eye is damaged. And we have a really, really dense network of nerves on the surface of our eyes. And so that makes us really sensitive to any kind of pain or discomfort involving the surface of the eye.
Okay, thanks for that answer. Do we have to take a break, Jay? We do have to take a break, come back, got the lines lit up, and don't forget, after Dr. Arora, we're going to have another expert, Dr. Christopher Saul, who's going to talk about oral cancer. Then we have Nickel State with Larry Howell. Of course, Graham Harvey is going to be on board. So we'll be right back. Don't go away.